Hey, Brian.
Oops, sorry, this is Scott. I'm kind of taking over for Brian for this call. Did you want permissions to record?
No, that's okay. Are you guys going to send it out?
We'll most likely send it out like we did last time.
Okay. Yeah, if you're not sure, then I should probably get permission to record. I was just checking to make sure my connection was working because I've had a little trouble with it lately. So
Yeah, we can send it out. Did you get the last one?
yes, I did.
Okay. Yeah, we can send that out.
Okay, cool. Thank you.
Yep.
Jeremy, is there any way to get an updated picture, not one from high school for you?
Come on. I think there's a 10-year statute of limitations on headshots, and that one's just about 10. It was only 10 years ago. So but we are working on some new headshots, yes. Yeah. Great. Hey, Dr. Frankel. Hi, Manny.
Hi, Jeremy.
We'll get started in just a couple minutes here. Looks like we'll have a good turnout from media. Welcome on board to all of our media partners. We'll get started in about 2 minutes. Okay, good afternoon, everyone. For the media partners on the line on Zoom here, feel free if you would like recording privileges to reach out to Brian Noonan, the host, shoot him a chat message, and he will give you privileges to record. I believe we are also recording, and we'll be emailing it out afterwards if you need that. And then please feel free to put any questions you have in the chat, and I'll facilitate the Q&A as we've done on our previous calls. So I'm Jeremy Nordquist, president of the Nebraska Hospital Association, and this is our third week now of doing these press calls on Monday. And really the focus is to open up and tell our story, be as open and transparent with Nebraskans as possible about what's going on in our hospitals right now. And we are facing a rapid increase in hospitalizations across Nebraska. Last week when we did this call, the numbers from DHHS were about 643 hospitalizations in the state. We're up to 735 in the last week. And from 1 month ago today, we've seen a 54% increase in hospitalizations. So if anyone's out there minimizing this or saying this just isn't happening, they're not telling themselves the truth, that the detriment of their families, their community, their neighbors. So we're, as hospitals, trying to make sure that that message gets out there, that we're still in a very challenging time. Outside of a very short window last fall, November, December, we are at the next highest rate of hospitalizations of this entire pandemic at this moment, all while our hospitals are facing significant staffing challenges. We also remain at record or near record high of positivity rates at about 27% in the state. And there might start to be a national narrative this week that we're peaking and we're coming down from it. Nebraska, maybe potentially will peak this week, but peaking in positivity and number of cases certainly isn't going to instantly relieve the pressure that our hospitals are facing. We're still in for a long haul here in terms of caring for Nebraskans in our hospitals. We're also, as we talked to our hospitals last week during district meetings, our hospitals are facing some compounding challenges. We have concern about blood supply in the state due to lack of ability to do blood drives. We're asking Nebraskans to help out. If you can, go sign up at your blood bank to donate, because we have hospitals who are doing their best right now, working together, sharing supply as needed, but we are getting to a critically low point of that. We're also, last week, hospitals are asking Nebraskans to make sure not to come into their emergency room for testing. We know there's short supply of testing across the state, but please don't compound the challenges we're facing with healthcare workforce by coming into our emergency rooms just for testing. Today, we have three great hospital leaders on the call who are going to give you some real good insights into what's happening in their facilities. We have Ryan Larsen, the Chief Executive Officer at Community Medical Center in Falls City. We have Manuela Banner, the President and CEO of Memorial Community Hospital and Health System in Blair. And we have Dr. Harris Frankel, the Chief Medical Officer and Chief Compliance Officer at Nebraska Medicine in Omaha. So with that, I'll open it up to Ryan to lead us off and tell us what's going on in Falls City.
Well, we're holding up. We have seen the increase in number of positive cases. We do community drive-through testing, and we've been testing about 100 new positive cases a week now. Our test positivity rate is at about 36 to 37%. And we've had days where our hospital is completely full or beyond what we think we can do. And then we've had other days where it comes down a little bit. Today, it has felt like a little bit of a reprieve, but then I looked and our ER is beyond our normal capacity. And so we have people we're taking care of, and we'll see how that goes. I am very proud of the people that I work with and the sacrifices and just the way that they have worked and have been working. It has been a marathon, and it just fills me with great pride to work with them every day. We're dealing with all the same things you referenced: challenging to get transfers for patients, finding enough blood products, and just staff being out. I think about a quarter of our caregivers are out right now. And so staff are picking up extra shifts and taking mandatory extras or voluntary extras, depending on how they like to think of it. And it's we've cut back on services. Hopefully people are still getting the things that they need, but we have to prioritize where we're able.
Thanks, Ryan. Manny?
Much like Ryan, thank you, and thanks for your time today. Much like Ryan, we see many staff illnesses within our staff, along with all the things that we have been dealing with for quite a while. Everyone is called to do a little bit more than they usually do, and our team has been amazing in helping each other out. The all hands on deck approach is working, and it's been wonderful in helping each other out, but we are kind of at the end of our added capabilities. So we take care of as many patients as we can on a day-to-day basis, and anything more is really going to start stressing our resources. Resources are scarce, as we all know, are not only human resources, but also supplies and you work that we need to have done by contractors in the facility is usually delayed. So that just makes things even more difficult than they already are.
Thank you. And Dr. Frankel?
Well, thanks, Jeremy. Good afternoon, everybody. First of all, I want to thank all of you for all the great work that you all do in your communities to keep your community members safe and healthy. We're in unprecedented times. Who would have thought, 2 years ago that we would be where we are today? It's been challenging, as you know. From a Nebraska medicine perspective, as you all recall, and if you didn't hear, I'd be surprised, but on January 13th, 12 days ago, we enacted crisis standards of care. And let me give you a little background about that. We began to prepare for the possibility of crisis standards of care as we were entering the surge with Delta. That was a significant surge. Patients were quite ill, obviously. And the rate at which that surge was occurring, we anticipated that we might actually have to declare a crisis at that time. As a result, we began preparing and drilling with our triage teams that are called for in our crisis standards of care plan. Fortunately, at that time, we did not have to declare. But then as Omicron hit in December, the rate and vengeance with which it struck the community was quite overwhelming. And we saw a significant demand for healthcare services across all our platforms, whether it be our ambulatory clinics, our diagnostic testing services, inpatient needs, surgical services, et cetera. And that combined with the significant absenteeism, tenfold to what we normally experience, we found ourselves in a position where crisis standards seem to be appropriate for the totality of our own circumstances. So just to refresh and give you some foundation to think about, crisis standards are enacted when the demand for healthcare services exceed the available resources to provide those services, and when the contingency strategies that are in place to preserve conventional or equivalent care are no longer enough. And we view crisis just like we would contingency or conventional phases of operation as a continuum in and of itself. Our tipping point really was that of the staff absenteeism and the inability to meet the demands across the health system. So we enacted, as I said, based on the totality of our circumstances, I would say that we are managing, holding our own. Our hospital census remains quite full. COVID patients occupy almost 22 to 25% of our adult inpatient beds. That's a significant impact on our ability to care for the other people without COVID who need inpatient care, much of the care of which is unique to Nebraska medicine. Our ambulatory clinics remain incredibly busy with increased demand because of the Omicron surge. Our request for diagnostic services remains quite high. Obviously, in preparation, we started dialing back our surgical services a few months ago, actually during Delta, to accommodate the need for inpatient care and to make certain that our nurses on the inpatient side weren't being overwhelmed with more patients than they could adequately care for. That being said, as the Omicron surge came upon us and the demand for services increased exponentially, we dialed back even further. We changed some of our staffing plans. We consolidated sites of care, et cetera. It's also had an impact on our ability to accept patients from all of you when requests for transfers come forward. Quite frankly, that has created a level of moral turpitude for our providers because we're so used to saying yes. Unfortunately, we've had to really tighten up our criteria to be able to accept outside transfers. We know that's created quite a bit of consternation for many of you. I'll just say I'm sorry about that, but that's our reality currently. We've obviously had to reschedule patients in clinic. We've had to cancel and reschedule surgeries and the like. And so it's been quite the inconvenience, I think, for patients. Our staff, to say that they've been overwhelmed for 2 years would be an understatement like yours. Resiliency only gets you so far. I saw in some of the topics to be addressed were going to be, I think, some of the behavioral health issues related to our own staff. So I look forward to that conversation. But most importantly, this is what I want to say, is I encourage all of you to lead by example, encourage your communities to get vaccinated. Beyond getting vaccinated, get boosted. We know that the vaccination, and specifically after getting boosted, the risk for serious illness, hospitalization, and death goes down significantly. Also encourage people to follow those non-pharmaceutical measures that we were so vigilant about early in the pandemic. Masking, distancing where appropriate, hand washing, et cetera. So I look forward to the rest of the conversation, Jeremy. And again, thank all of you for all that you do for your communities.
It's, Dr. Frankel, and obviously good advice. We certainly need to continue to encourage. I think we're up now to, well, it's well north of 70% of Nebraskans who have at least gotten one vaccination shot, and continue to encourage them to complete the entire complete all the shots and the booster, and those that haven't to continue to consider it. Ryan, go right ahead.
Yes, could I respond to Dr. Frankel?
Yeah.
I have very much appreciated the resource that Nebraska Medicine and our other health systems in Nebraska have been. I was a little surprised about a month ago talking to a colleague in Missouri. They got hit a little faster or sooner than we did. And I was talking to them about their crisis standards and how they wish they'd started sooner. And so I asked for their documents. And what they were sending back to me were documents from Nebraska Medicine. And that's what they were using and promulgating in their state on the best way to do these things. And the 6 hospitals in Southeast Nebraska were all smaller. We've gotten together and we've been going through our own triage and crisis plan. And again, CHI and Nebraska Medicine are very generous, letting staff participate, provide feedback, serve as ethicists for our groups so that we can try to prepare. We know you can't take all of our patients that you used to, but we're so grateful that you're helping us try and do our best to get ready, because this is unprecedented for us as well. So I really hope the state of Nebraska realizes how fortunate we are to have regionally, nationally, internationally recognized experts, and that they're being willing to look outside their own walls to be a resource.
Brian, thank you. Thank you for those comments. I mean, we're certainly very proud to be viewed upon as a trusted resource for information and education. I will say this, that if there is a silver lining to be had in the pandemic, I think it has brought all of us together in a manner that we wouldn't have thought possible previously. I think the collaboration and cooperation to develop planning, protocols, the state crisis standards of care, healthcare protocol that was developed by a multitude of stakeholders from across the state, I think speaks to who we are as Nebraskans and speaks to the fact that we're better together.
Right. Go ahead, Manny.
First of all, the support and collaboration from CHI, from UNMC, and the other large health systems has definitely been helpful for us. We are seeing those difficulties in transferring patients, and unfortunately, they're not only an inconvenience because these are patients that really, really have the need to be in the larger systems. And that's where it becomes really difficult for us to find that middle ground. Which are the patients that we can take care of and which are the ones that really need to move on to larger systems. We have done a great job in learning and expanding our capabilities as far as census and acuity, but there are still those patients that are much better served and that have to be served in a metro facility. And that's where the difficulties really hit us hard.
Great. I did want to mention one thing, both with what Dr. Frankel and Manny mentioned regarding just transfers. And one thing we are working on that maybe will hopefully help in that direction is just relieving, decompressing our larger systems with some help from the state. I believe it was late last week, Governor Ricketts testified before a subcommittee in Congress. So this is a little more public than on previous calls, where he said they're stepping forward to open up to about 100 beds between Omaha, Lincoln, and Grand Island for skilled nursing, to hopefully move patients who are, that's the appropriate level of care for them, to those facilities, relieve some pressure, and hopefully help other hospitals transfer when needed. So that those beds should be coming online early next week. Hopefully a week from today, the first ones will start opening up. And as we continue to see these very high levels of hospitalization in our state, that might help us a little bit with the pressure. We do have a couple questions submitted here so far. Are there any new warning signs on the horizon regarding new complications or new variants? Also, any new guidance regarding vaccinations? Anyone want to take that one?
I'll go ahead and take a stab at that, Jeremy. So, I think there have been a number of different variants, but none that have reached the status of Omicron, Delta, or the wild type. But investigators are constantly surveilling and looking at some of the different variants. But some of those have not yet, had a clinical or community impact yet, like those we've experienced. In terms of vac status, I've not heard anything on the horizon coming that would suggest that a fourth vaccine necessarily will be beneficial. Clearly, though, the booster for those that have received the 2-series vaccine of Moderna and/or Pfizer, and certainly a booster for those who have received J&J, we know the benefits of that. I believe there was some recent information out of Israel that suggested perhaps a fourth vaccine didn't necessarily provide a significant increase in immunologic benefit to that over the third. But I think there's, a lot of this is still being worked out. There's still data to be had and studied. So certainly nothing definitive at this point.
New York Times reported that Nebraska is among states that have 10% fewer staff than they did in November 2020. Does that jibe with what you're seeing in your facilities?
I would definitely say that jibes with what we see. We've seen some early retirements in individuals that would have maybe worked longer. We're seeing a move from clinical nursing and clinical jobs to more administrative jobs. So I would say 10% is probably more on the conservative side.
10% would be a little high for us. We're probably under that, though we do know there's some people who are saying they think they may have had enough. And if we look at staff that are out, it's definitely up there. I think our HR department said they are, what is it? They're searching to fill 300 to 400% more positions than they normally do. So it's 3 to 4 times what they're normally looking for. And so we're seeing it from that standpoint. And you don't want to hire more administrative staff when you're really looking for more clinical staff. And so it just adds more challenge there.
And Jeremy, for us, I think 10% would be a little high as well. That being said, that we have been more aggressive in our return to work policies and getting people back to work, though notwithstanding that work, we're still seeing a sizable number of nurses and CNAs absent. And so that remains a concern for us. And obviously the sites of care in which your absenteeism is most impactful is clearly those direct clinical care sites. And so there's only so much you can do to support through redeployment, because the necessary skills to provide the service given the site that service is being delivered. Yeah, we have been able to reduce the totality of absenteeism by some more aggressive return to work policies, obviously still maintaining the safety of the employee and our patients. But I don't think we are yet at a point where I would declare victory over Omicron's impact on absenteeism.
How soon after the Omicron peak do you anticipate hospitals calming down? That's the question.
I've guessed wrong at every stage of this pandemic as far as when things are going to spike and go down. So I'm going to humbly defer to those who perhaps have been better prognosticators than I've been.
I don't think that I can prognosticate any better than Ryan, but I do think that the staffing shortages will affect us for a long time to come, specifically in those areas where there's an educational component, so nurses, respiratory therapists, et cetera.
Yeah, I would agree with Manuela. I think if you look at what's happened on the coast, particularly the East Coast and other countries, is that the descent of the curve has been fairly rapid, like the ascent. That being said, when you take into consideration the other factors in general, and certainly the workforce specifically, the recovery, even though the case counts may be coming down significantly, and the impact of hospitalizations, there's still the issue of the workforce that you've got to consider. And so we have lagged, typically several weeks behind the East Coast. I still think we've got, maybe 10 to 14 days perhaps before we hit our peak. Maybe not. It could be sooner. I hope it's sooner, but just I don't have a crystal ball like everybody else. But there are just a lot of variables that are necessary to consider prior to making or being able to make any cogent prognostication of what recovery looks like.
I might add, we're starting to see more of those, the long-term cases or the post-COVID, where people are saying, I'm just not bouncing back, or relatively young people that are experiencing dementia or psychosis or other things that is unusual for our community. And we're still learning how we're going to do that. I guess people ask, are they here for COVID or with COVID? And sometimes, well, they're past that, they're here because of COVID, and they're just not getting better. And so, that's another challenge that we're facing.
I think what we haven't even touched on too are those individuals that haven't been seeking care over the last couple of years because of COVID, that were worried about entering healthcare facilities. And I don't think that we have seen the full impact of what this is going to cause in the long term with those patients.
I think that's a really good point, and certainly one we've talked about. if you just look at the national evolutionary progression of individuals with chronic disease, there's always going to be a certain percentage that are going to require acute care intervention. When you layer on top of that the number of people that put off care because of the pandemic, to your point, that just adds a total, another layer of patients in need of acute care intervention that perhaps would have received that sooner, and maybe even been able to modify some of the risk factors that led to that acute care intervention a long time ago. And to your point, it's compounded the number of people requiring acute intervention, the number of people seeking out acute services, even in the clinical setting, the ambulatory clinics. The other thing I think that we're going to have to deal with, and I don't think it's unique to Nebraska medicine, CHI methods, but also to the rural communities, is that it's at a certain point, we're going to see people who come to the hospital like we do now, but probably more prevalent, who are there because of true medical reasons, not because of COVID, but they test positive for COVID coincidentally. And then what do we do to be able to safely cohort those patients? Or can we cohort all those patients going forward in a manner that we've been able to do so in recent times with the appropriate isolation rooms, negative pressure units, et cetera? Because it's I think predictable that we will see more and more patients who just coincidentally test positive for COVID absent real symptoms, that we're going to have to determine how are we going to manage the increasing numbers of those patients.
We have a question here. I can take this one about anything else about the governor's plan. So just for those that haven't been on our previous calls, we've been working the Hospital Association with the governor's office and DHHS, as well as the Healthcare Association, which is the Nursing Home Association, on trying to open up capacity, because we know that's a bottleneck to get people discharged right now. Nursing homes are going through the same staffing crisis that we are, and we want to help them be able to help us so our hospitals can all serve who they need to be serving. Right now, the details essentially are three locations, opening up wings of skilled nursing facilities that have been closed with outside staffing support. The state would be using some of the federal funds they've received to open up those facilities. And we think it'll end up being, again, starting early next week, and end up being about 100 beds for at least several months to be able to relieve some of that pressure. So those are the details we have right now, and I'm sure the state will do a formal release here, probably within the next week before they roll these out. I have a question here. What's the longest you've seen it take to get patients transferred? So talk about the challenges with transfers right now.
We've seen multiple days. What we've learned in the meantime is to know our own abilities. So there have been times when we have been able to keep patients and get them better that we wouldn't have kept in the past. So we have learned our own abilities much better. But we have had patients that have waited for a bed for 3-4 days.
Yeah, our normal length of stay is 3 to 4 days. And we might have a patient that goes a little beyond that, a week or so here and there. But with this time period, we've had very sick patients that it can take several days. We've had some that have taken a couple of weeks trying to find transfers for. And it's both staffing, but also the amount of supplies we have to have if we're going to do sedations or other things, and it's a challenge. I think our longest was 4 weeks. We had someone admitted just after Christmas, and his COVID symptoms, he passed the time that we thought he was contagious, but he just was not doing well. And we got busy enough. I'm not a clinician like Dr. Frankel or Manny, in addition to their administrative hats. So, we let me sweep up a little bit and pass out meals maybe, but as they got busy, the nurses, I asked what I could do, and they said, well, come down, you need to pray with someone. And so, and our staff, in addition to their clinical side, I think people in healthcare often have that spiritual calling to it, but in this case, it was me. And he couldn't really respond. He was all curled up and shaking, and I just prayed with him. And that's what staff are doing. And sometimes that's all we can do to add. And he's a veteran. And I remember thinking, here's this man that has served his country, and he doesn't have family here, and we can't find a place to take him. And staff are really busy. They're doing their best. And if what I can do is sit here with him and have a human connection, I can do that. And he finally this weekend, instead of being transferred, came to, was able to actually go home. We were so excited for him, and he was just so grateful. But we are taking care of people in new ways. And it's that all hands on deck that I heard Manny mention earlier. It's about everybody trying to help in whatever way we can. And it's why I'm so proud to be a part of what we're doing.
Ryan, anyone else? That's all we have for questions. Really appreciate all of your time. Thank you to the media for joining. And as always, for the media on the call, any questions or follow-up, please feel free to reach out to the Hospital Association. We're here to help connect you to any of our members and get the message out. So thank you all.